Good morning, everybody. Thank you, Minister. Thank you, Ben. I'm talking to you in my role as Victoria's Chief Psychiatrist, and I want to talk about the impacts on our mental health and our sense of wellbeing with the midst of the COVID epidemic. It's a very uncertain situation that we find ourselves living within, and I think...
I want you to speak up.
can everyone hear me? I want to make sure that we actually think about the impact that this is having for all of us. It's impacting on our own sense of well-being, our anxiety, our stress level. We're all feeling to some extent confused and obviously very uncertain about the future. I want to really emphasise this is a very normal reaction to a very abnormal situation that we're currently experiencing. But the good news I want to share is that fortunately most of us will be able to cope with this challenge. We'll use our normal resources, our strengths, our sense of resilience and the support that we have around us from our family, loved ones and friends. However, we also need to acknowledge that some people will really struggle, particularly at the moment. Some people are really travelling hard. The people who are really struggling, I really want to emphasise we do have help available. We need to identify the people who are finding this extremely challenging, and we need to reach out. We need to think in our networks, our social networks, our family, our friends, our kids, our colleagues at work, our schoolmates, who might be finding more difficulty and is going to need some extra help, and make sure that we can link them into the help that's available. I want to really focus on a particular vulnerable subset of our community that sometimes we might be in risk of overlooking, and that's our kids and teenagers and their families who are really experiencing some of the impacts on their mental health. So I want to give a few specific messages that I'd like you to take note of. The first message is we need to feel positive, that people will be able to cope with this, that children and families are resilient. They will have the capacity to use their strengths to get through this very challenging situation for the majority. I also want to stress that there are a few simple things that parents can do to try and help their kids in the recovery. Very basic, simple things such as maintaining normal routines. That's particularly important when we've got a situation of homeschooling at the moment, to get that balance between study, relaxing down times, chill out times, certainly exercise and meal plans, but also more importantly around sleep patterns, particularly for our vulnerable teenagers. But the thing I'd most like to stress is that we need to be talking to our kids about how they're coping. Please, please, please reach out to your kids. Don't be anxious and afraid to have the conversations about how are your kids coping, how are they feeling at the moment, what are their challenges and their confusions about what's going on. I'd really stress this is a series of conversations. It's not a one-off, single, intense conversation. Choose your opportunities as a parent when you might be doing an activity with your child where you can have some of those conversations. It's a case of less is more and repeated conversations to explore how your child might be feeling. Do encourage them to ask questions, and as adults try to answer those questions as truthfully as we're able to do. It's really important to acknowledge kids' feelings, to recognise and help them to understand how they can manage these distresses that they're experiencing. The third message I want to get across is that help is available. We have different levels of help that are available for people who are struggling. Do identify the kids and also their parents who might need extra support and extra guidance. On the department website, I want to put some resources that are available. We have many online resources to help both kids and families. We also have telephone services such as Kids Helpline, one of the many excellent telephone counselling services that kids themselves can access. I'll also give some pointers, some advice about what parents and kids can do to look after their own mental health. Particularly if you're really not sure what to do, my advice would be reach out in the first instance to your family doctor, Also reach out to your kids' school, to the teachers, the classroom teacher, the year coordinator, the welfare staff, to try and get advice. Some people are going to need other counselling services, such as Headspace being one of many, and many of those services are available through telehealth, so you may not need to actually appear face to face. The service sector that I represent is the specialist mental health service, the area specialist mental health services and their triage services, which again can be a very useful source to contact, to get advice, and they can triage and work out the level of urgency if you need something more intense. I really want to stress thinking about children and teenagers and their families, because I'm worried that they could be a bit forgotten in this epidemic. I'm also very concerned that we know the research tells us the earlier we can identify problems, the better the outcomes. So we need to make sure we intervene as early as we possibly can.